seems a bit sad that we had to stop it, really, doesn't it? But it's great to hear to see some smiles on people's faces, and to hear that you're enjoying that. We always like to do a bit of grooving in the morning. Welcome everybody. So this is our 7th masterclass. If you've been to all of them, you've been on quite a long journey with us already. If it's your first, don't worry, we'll explain how it's all going to work. So my name's Catherine Wilton. I'm one of the Deputy Directors in the Personalised Care Group of NHS England and Improvement, bit of a mouthful. I, along with my team, an extended team, have been running the Leadership for Personalised Care online programme since before Christmas now. And we have a national programme and some regional programmes, but during this last year we've taken it online and tried to reach a wider audience, which is fantastic. So welcome if it's your first one. We're delighted that we're going to be joined by Professor Michael West today to talk about lessons from the pandemic, compassionate leadership for personalised care. And this module is a little bit different from the others, because in the other modules we've been talking about personalised care itself and the leadership qualities to make personalised care happen in the community. This module goes a little bit more internal and thinking about ourselves and how we apply those principles of personalised care to ourselves, our teams and others in service of achieving our mission. So first of all, to introduce you to our team. So you'll see on the next slide, we've got lots of people helping you again today. So you've got me as your host, and Christy is going to be your co-host. I'll introduce our keynote speaker in a moment, and I'll be calling on Maggie and Alison and Paul to see what you're writing in the chat, to be a conduit for your comments, because as much as we would like to have an individual conversation with all of you, there's over 100 people on the call, so that's sometimes a bit difficult. Okay, next slide then, Molly, thank you. So first of all, before we start, I would like to just get some ideas from you about what you think this module is all about. So in the chat, could you tell us what you think leadership for well-being, equality and inclusion means to you? Just give you a couple of minutes to type some comments in there. So what do you think leadership for well-being, equality and inclusion means to you? Maggie, what's coming through in the chat?
So we've got some lovely comments really about being a role model, self-awareness, and there's a lovely comment about allyship, which I really liked. And then Dawn's just written inclusion, caring and being authentic. Just wonderful, wonderful.
Thank you. Let's try the next question then, because it's similar, but I think making the link between leadership for personalised care and this idea of compassionate leadership. If personalised care means having choice and control over your life, and it also means an integrated and holistic approach to care and support, how does that apply to me and others in the workforce? How do we apply the principles of personalised care to ourselves and to those we work with? Alison, anything that you'd particularly pick out from the chat here?
Alison, you might be on mute.
Yeah, I am. So comments about being role models and pathfinders for existing staff, being supportive, caring, inclusive, respecting boundaries, comment about consent, respecting people's autonomy.
Yeah. Absolutely. There's something really clear about the role model. About this module really is about yourself as a leader and how you show up. And I think that's what we want to cover a little bit.
And there's something interesting also about taking time to care and care for yourself. So if you can't care for yourself, you can't care for others.
Thank you, Alison. That's a really important point. So self-care for leaders being very, very important. And it's that concept, isn't it, that you bring the oxygen mask down for yourself before you can help anybody else. And it's been an extraordinarily difficult year. And sometimes we think we can't stop, and sometimes there might be good reasons that we can't. But sometimes there are small things that we can do to build in that time for self-reflection and recovery for ourselves. And it's the culture that makes us think we can't, or we don't have that control. So what can we do as individuals, a power move in the system to enable that to happen more? Okay, thank you for that. And thank you for your really insightful reflections so far this morning. So personalised leadership for wellbeing, equality and inclusion. And we wanted to put this in our programme because we think it's really important to be thinking about how we apply the principles of personalisation to ourselves and our staff. You'll recall, if you've read the first booklet that we sent you on leadership for personalised care, that we talked about connection, belonging and autonomy as universal human needs. And personalised care, of course, does itself come from humanistic psychology, as well as people asserting their rights to choice and control over their lives. So that kind of social movement we talked about. But focusing on what matters to people and ensuring that people and communities have a say about what happens to them results in better outcomes. There's evidence around that, and we've shared that with you too. But the same goes for our staff. You know, if we feel connection and belonging and autonomy at work, we're happier and more motivated and actually do a better job. So it strikes me that we cannot afford to ignore this at all, particularly if we want to make personalised care happen, or any change happen, any transformation on health and care services, without thinking about how we treat our staff and how we look after ourselves as well. And I think there is a really strong link here with equalities. And so thank you for the person who mentioned allyship, because it's actually about a deep commitment to equality and inclusive practice that is at the heart of getting the most out of staff and getting the most out, making that transformation into personalised care within communities. So it's more than just being nice to people. This is about an absolute fundamental mindset and potentially shift in the way we work to make sure that people are respected and have equal value wherever they are in the system at all. So that's what this module is all going to be about. And I'm absolutely delighted that we've got Professor Michael West here today to tell us a little bit more about his research and the fantastic work he's done. So you'll see that this is the last module. With the course booklet for this module is actually in production at the moment, so look out for that one. And you will of course know that the other modules are available, and we'll share these slides afterwards. So we've got a YouTube channel, and the course booklets will be available on the drive that we have. I'm going to hand over to Christy just to remind you about how we work together today. So again, particularly for the people who haven't been on one of these masterclasses before, it's a sort of ground rule of how we work together.
Thank you, Catherine. Can you hear me okay? Yeah, good morning, everybody. It's so wonderful to be with you, and I have met many of you, so welcome. And to those of you that I haven't met, hello, you're equally welcome too. And if this is your first masterclass, then I think you're in for a bit of a treat, if I'm honest. So those of you that have joined us over the programme so far will know that what's really important to us is that we set some ground rules and work out how we're going to work together to get the best of ourselves and each other. So you will have seen these slides, but there's never any harm in reminding us of the important stuff, is there? So we are recording the session, except for the group discussions, and that will all go up on the YouTube channel. We have a shared responsibility for each other's psychological safety and learning, don't we? Which includes respecting confidentiality. And what we mean by that is that, that we're all able to show up today as we are, authentically and genuinely, without fear of being judged, without fear of people making assumptions about us, and that we create a safe space for each other to ask questions, to share and to learn. So that's absolutely how we've always worked together when we've come together as a group. But just a reminder that to be a compassionate leader, it's really essential to create that psychological safety. We are using the chat for all communication. That seems to be working rather well so far. Please don't worry about spelling mistakes. We don't worry about making spelling mistakes because we know that you're not judging us. And the chat's being monitored by our team, as you've seen so far. So type away. Please do ask us any questions. If you do ask us questions and we don't directly respond to you, then I'm sure you'll understand that there are almost 130 of you on this call, but we will do our best. Any tech issues, please note it in the chat and Molly or Rosie will help. And if we have any tech issues, bear with us as well. And we've got a bullet point there about you get out what you put in. And I think this every time, you know, that's life, isn't it? You get out what you put in. So please do get involved in the chat, keep your cameras on in group discussions. It's really important that other people know that you're present and that you're listening to them. And then our favourite phrase, self-awareness is your leadership power, and leadership development starts with you. So I think, Melanie, I noticed in the chat that you wrote something about self-awareness when we asked you the question earlier. And so this is about your ability to objectively see yourself, to manage your emotions, to align your behaviours with your values, and have a sense of how other people perceive you as well. And all of those things are about compassionate leadership, aren't they? But they're particularly important today, as you show up today. Please stay for the whole session if you can. We're so lucky to have you. You're on this journey with us. We're all in this together, and you will get the benefits if you protect this time. So I'm sure that people can wait for your attention. So what I'd really value from you now is just a check-in with you to make sure that you're all happy to sign up to these this way of working. So could you pop I consent? Thank you, Rosie, for kicking that off. Thank you, Melanie. I consent into the chat box so we know that we're all on the same page. Thank you so much. That's fabulous. Lovely. Next slide, please. Okay, so just a brief look at what we're going to be doing together today. So this is the welcome and introductions. Catherine's going to introduce you to Professor Michael West. Then we'll have a group discussion. So we'll go into those random breakouts like we've done previously, have about half an hour to think about what we've heard from Michael and what it means for us as leaders. And then we'll come back together and do some final words and think about what's next on the programme. Thanks, Molly.
Thank you. So I'm going to hand over in a moment to Professor Michael West. Michael is Senior Visiting Fellow at the King's Fund and Professor of Organisational Psychology at Lancaster University. We're delighted he can join us here today. Michael's work on teamwork, leadership and culture, and particularly in health, has been really influential in bringing the concept of compassionate leadership into the health and care system. And it's kind of a key part of what the NHS Leadership Academy does now. And like I said before, when I've heard Michael talk about compassion, it really struck me that we were talking about the same things, but would perhaps apply them in different places. So it's brilliant that we can bring them together here today. I think you'll find what Michael's got to say inspirational and possibly challenging, because I think it actually means that we have to maybe do something different ourselves to achieve something different. But I'll let you make up your own minds and have your own reflections. So without further ado, over to you, Michael, and thank you for coming.
So thank you, Catherine, and hello, everyone. It's a real pleasure and privilege to be with you this morning. Times of great difficulty are times when we have great opportunities for learning, and I believe that every leader, every team, every department, every organization must take the opportunity at the moment to take the time to reflect on what we've learned from this last period of all of our lives, with humanity facing a worldwide epidemic. What have we learned about what's enabled us? What have we learned about what's gone well? What can we take forward for the future? What have we learned about what didn't help, what got in the way? And there are two particular lessons that I think are really important to draw out for work in health and social care, particularly work in relation to personalised care, and I think for humanity generally. And they're to do with compassion and the space also for reflection and learning and stillness. So compassion, I think, is what has been the most important factor in holding us together during this period. The sense of safety and connection and being held, the compassion that health and social care staff, voluntary sector workers, community workers have shown to service users, the compassion that people at work have shown to each other, the hugs, the cups of tea, the checking in on each other, and the compassion that people in the community have shown to their neighbours and to all of those around them, that's created a sense of safety. And compassion is what enables us to feel connected, to feel a sense of belonging, those key values that Catherine talked about. Compassion is what binds us together in a way. It involves 4 behaviors. For me to be compassionate to somebody in pain or distress, I have to do 4 things. First, I have to attend to them, to give my attention. Attending also means being present. And Nancy Klein's phrase, listening with fascination, is a beautiful evocation of what attending is. And second, I have to seek to understand the challenges that the person faces, somebody in pain or distress or fear. And that understanding is achieved best by having a dialogue, not by me imposing an understanding from a paternalistic or hierarchical professional position, but through a dialogue where we arrive at a shared understanding. And third, I have to have an empathic response. I have to mirror or feel the other person's pain or distress or difficulty without being overwhelmed by it, because that gives me the motivation for the 4th element of compassion, which is offering to help or serve in some way the other person. So those 4 behaviors, I think, are the 4 behaviors that constitute compassion, blurring the boundaries between self and other. And I think they're also the behaviors that constitute what we mean by personalized care. And we know that there's a real difference between sympathy or empathy and compassion. So neuroscience studies show us that when we ask people to be empathic or sympathetic to another in distress, that's associated with the activation of pain centers in the brain, understandably, because we are mirroring the other person's pain or distress or fear. Yet when we ask people to be compassionate with that additional offering to help or the intent to serve element, that's associated with the activation of reward centers in the brain. And again, that makes sense because we know that the vast majority of us, of we humans, 99% of us, have evolved a hardwired orientation to help others, to be altruistic, to be compassionate, because those behaviors, those impulses enable us to bind together as groups, as communities, as families, as teams, and to create that sense of belonging, which is so important to human well-being. We are as likely to die from the effects of loneliness as we are from the effects of, say, smoking or obesity. But we also know now a lot more about the importance of compassion in health and social care from recent reviews of all of the research literature on compassion in health and social care, particularly a review conducted by Tresiak and Mazzarelli, 2 American medics, back in 2019. And I want to just show you a few of many, many highlights that review of hundreds of studies has revealed. For example, in one randomized controlled trial, a sort of gold standard of research, anaesthetists either visited patients prior to surgery and gave them sedatives and had a normal interaction with them as they usually would, or they went without sedatives and were extra compassionate. And what that revealed was that in the compassion intervention, patients were calm before their surgery, but not drowsy, whereas in the other condition, patients were drowsy, but not calm inside. And it was associated with a much lower requirement for painkillers post-surgically and a significantly shorter length of hospital stay. Another randomized control trial, a very large study of patients with an early diagnosis of non-small cell lung cancer, which is likely terminal, assigned either to normal early cancer care or to early palliative care, if you like, extra compassionate care. And it's a study of quality of life, and it indeed showed that those people assigned to early palliative care had a much better quality of life. But the surprising finding and unexpected was that they lived significantly longer. And we see similar large effects of clinician compassion, be it nurses, doctors, allied health professionals, in the treatment of long-term conditions like diabetes or HIV, and large effects of clinician compassion in the treatment of mental health difficulties. So compassion is fundamental, and the evidence suggests that, contrary to what most believe, compassion doesn't take longer. Personalized care doesn't necessarily take longer. And interestingly, the research also shows that whether it's GPs or nurses who we ask to be extra compassionate in their interactions, or domiciliary care workers extra compassionate in their interactions over a 14-day period, that has a significant impact on their own well-being, with lower levels of anxiety, stress, and depression. And the effect sizes are truly remarkable. So we see the effects of compassion are greater than the effects of aspirin in the treatment of heart attacks and of statins in the 5-year risk of a cardiovascular event. So overall, what this research is telling us is that across the board, compassion is the most important intervention there is in health and social care. And the challenge for us as leaders is, well, how do we create the conditions in our teams, our organizations, our voluntary sector organizations, our housing associations? How do we create the conditions where people will be compassionate in their interactions with service users, and indeed in their interactions with each other? And the answer to that is that every interaction we have in our work every day is an opportunity to shape the culture of our organizations. How kind we are, how irritable we are, how warm we are, how cynical we are, how compassionate we are, in every interaction shapes the culture of our organizations and indeed our communities. The role of leaders is particularly powerful because we focus on the behavior of leaders. So what leaders pay attention to and monitor and talk about, and particularly what they model in their own behavior, tells us what it is they value. And values constitute culture, not what it says on the website about culture, but what we value in practice, what we give our time and attention to in practice. So leaders must embody in their leadership these 4 compassionate behaviors of paying attention to those they lead, listening with fascination, seeking to understand the challenges they face, empathizing with them, and then helping them. And we know from the leadership research over the last 60 or 80 years that these 4 behaviors are critical to effective leadership. They predict organizational performance in the private sector. They're the key predictors of trust performance in the NHS. They're key predictors of the performance of primary healthcare teams, community mental health teams, and so on. We know that probably the most important skill of leaders from all of the research on leadership is listening to those we lead. We know that provides the basis for arriving at a shared understanding of the challenges that people faced in their work, not through leaders imposing a hierarchical understanding, but through a dialogue where we arrive at a deeper, more comprehensive understanding. And we know that emotional intelligence is critical to effective leadership. And it is important to stress that before the pandemic arrived, levels of stress in health and social care were at the highest they'd ever been, with huge numbers of vacancies, staff leaving, 1 in 4 nurses leaving within 3 years of joining the NHS, high vacancy rates amongst general practitioners, turnover rates in social care of 30% a year. So emotional intelligence is fundamental, and our thinking for the future must be about transforming our teams and organizations for the long-term future. It's not just about recovering from the pandemic and going back to where we were. We can't do that. And of course, there have been huge increases in stress amongst those working in health and social care during this last 13 months. And the most important task of a leader, we know, is helping those that we lead to do their jobs more effectively by working with them to remove obstacles and or ensuring they have the resources they need, the right numbers of staff with the right skills, the right equipment like PPE equipment, the right technologies, and the right training and development. And it's no coincidence that these behaviors are the same behaviors that constitute compassion. The same behaviors that constitute effective leadership are the behaviors that we identify as compassion, because and that we identify as key to personalized care, because these are the behaviors that enable us to connect, to feel a sense of trust and belonging, that blur the boundaries between self and other, that empower both of us in our interaction by connecting in this fundamental, authentic, immediate way. But this is not, it's important to understand as well as that this is not some soft cushions or scented candles sort of approach to leadership. On the contrary, compassionate leadership is ultimately compassion for and with the people that we serve, the people that we seek to enable to lead fulfilling, rich, safe lives in loving contexts. So our compassion is ultimately for our communities. And that means a strong focus on achieving the outcomes that we want for our communities together. It means a really strong focus on managing performance compassionately. And it's certainly not about taking some easy consensus way forward, because sometimes our compassionate leadership in service of the communities that we serve will mean going against those we lead, very much as Nelson Mandela did when he was released from Robben Island prison and went against the millions of ANC followers, refusing to lead them to war against the apartheid regime, and instead insisting on trying to find a negotiated way forward out of his greater compassion for his country. And it's about institutional compassionate leadership as well. It's about how our teams and organizations behave to each other across sectoral boundaries, for example, and across team boundaries, attending, understanding, empathizing, and helping. So compassionate leadership is about these 4 behaviors, but it's also about effective leadership. And effective leadership is about creating together clear direction and inspiring purpose or vision for our teams and organizations. That's not some dead bunch of words on the website, but is the beacon that guides our decision-making collectively, day by day, hour by hour, moment by moment. And it's about ensuring that there's alignment of efforts towards that vision, that there are clear goals in our teams and for individuals and in our organizations, and that our teams and people are working together in a coordinated, supportive way towards achieving those goals. And it's about creating commitment through developing trust and motivation. There's a lovely little book on direction, alignment, and commitment by Cindy McCauley and Lynn Fick-Cooper from the not-for-profit organization Center for Creative Leadership in the States, who developed this model. And second, if leadership is not inclusive, then it's not compassionate. And we've seen during the pandemic the dreadful effects of the virus upon people who are disadvantaged or discriminated against in society, the disproportionate impacts of the virus on those with disabilities, those from lower socioeconomic groups, those from minority ethnic groups. And what that has done is to put a spotlight on what we already knew, that excluding people, whether it's a child being excluded from a friendship group in a playground, or somebody who is ignored or whose voice is not valued within a team, or somebody who is excluded on the bizarre basis of the hue of their skin or their gender, that has a profound impact on health. And so discrimination and inclusion are health issues, they're moral issues, they're value issues. For example, the welfare state was created in 1948, I think, with the two core values of compassion and inclusion: high quality care for everyone, regardless of their wealth, status, prestige, background, skin color, sexuality, gender, age, socioeconomic status. And diversity is a performance issue. We know that diverse teams and boards and organizations, when they have a positive culture where diversity is valued, outperform other more homogenous teams and organizations. Diversity enables us to make better decisions, whether it's diversity of professional background, opinion, the organization we're based in, our nationality, our ethnicity, our gender. Diversity is the stuff of the universe. The universe is by its nature diverse, and we must embrace diversity and difference for now and for the future. And now must be the moment, I believe, in our health and social care and voluntary sector, housing, community, local authority organizations. This is the moment to transform our organizations for the future, to make them inclusive as a model for the rest of society. And that can't just be about scratching around the edges of this issue. That's about all of us each of us taking continuous commitment to equality and inclusion, and positively valuing difference, and learning to manage conflict in positive, ethical, transparent, courageous ways. And compassionate leadership is about collective leadership. It's about not aggrandizing power or being arrogant or narcissistic. It's about enabling everybody to feel that they have control and leadership responsibility and leadership rights. The bizarre paradox in, for example, if we take the NHS, is we have the largest, probably the most skilled and motivated workforce anywhere in industry, but we manage them largely through command and control, which means that we don't utilize their knowledge and skills and experience and abilities in decision making. You know, the most effective organizations in the world have only 3 or 4 reporting levels, regardless of their size. And every time you add a reporting level, you add 10% to bureaucracy. So adding stuff that gets in the way. So it's about creating collective responsibility. And it's a key principle in a way, I think, of personalized care. Shared leadership in teams, we know, is what's effective in teamwork. We may have a hierarchical leader, but that person's role is to bring in everyone's contribution and skills and knowledge and experience. And when a particular person has expertise in relation to the task in hand, then that leadership, the leadership seamlessly shifts to them. And it's about compassionate leadership is about working compassionately across boundaries. We so often hear talk about silos. And if we are to respond to the challenge of creating healthy, happy, sustaining, loving communities, then we have to work in an integrated, interconnected, seamless way. And that means, instead of having an us and them approach, to always create, blurring the boundaries between our teams and organizations and sectors, and always asking the question of the other team, organization, how can we help you? And the final point, I think, and it comes back to what you were saying at the beginning, Catherine, is that well-being and equality and inclusion for leaders to compassionately promote well-being and equality and inclusion, that requires that leaders have an understanding of the core needs of people at work. In fact, I think they're our core needs as human beings that you mentioned. And I've had the privilege over the last 3 years, first of co-chairing an inquiry on behalf of the General Medical Council into the health and well-being of doctors across the UK. And then last year, on behalf of the Royal College of Nursing Foundation, leading an inquiry into the health and well-being of nurses and midwives across the UK, along with colleagues from the King's Fund. And we used as a guiding model, a model that we called the ABC of core needs at work, which has well-established empirical support that describes the 3 core needs that we have in our workplaces and indeed in our lives: the need for autonomy and control, the need to have control over our work lives in order that we can make intelligent decisions about how we do our work and live and work in a way that's consistent with our values. And that means having a sense of authority and influence. It means working in cultures of justice and fairness rather than what many people describe as their workplaces of fear and blame and discrimination and exclusion and unfairness. And it's about creating working conditions where people feel that they have control and over work, influence over work schedules, where they can take breaks, where they can get access to hydration, nutritious food, and so on, where they feel safe. And we know that belonging or team working is fundamental, that if you work in a team that just has clear objectives and that meets regularly, that's associated with 50% lower levels of stress at work, much less in likelihood of intention to leave, and that team working delivers what we want in organizations. So we see in NHS trusts, for example, that the more real team working there is, where people work in teams that have clear objectives and meet regularly to review their performance, the lower the levels of errors, stress, injury, the better the care quality, the higher the levels of patient satisfaction, the better the financial performance actually, and in the acute sector, significantly lower levels of patient mortality. So building team working back better is key to the future. And the third is the importance of our need for a sense of competence or contribution, that we're making a positive difference through our work in society, in organizations, and in our communities. And the key factor that we found impeding that is people facing chronic excessive workloads. We just keep adding to people's workloads. And a lot of what we add isn't helpful to the core vision or purpose. So chronic excessive workload is the number one predictor of staff stress. It's the number one predictor of staff intention to quit for example, across the NHS and in social care. It's the number one factor in service user dissatisfaction. We're too busy to be compassionate. We're too busy to commit to personalized care. It's also the number one inhibitor of innovation. We know that chronic excessive workload is associated with staff cardiovascular disorder, disease, addictions, cancers, diabetes, depression, and in some cases, sadly, early mortality. So if we're not talking about chronic excessive workload, then we're not talking about the most important factor in relation to staff well-being. And it's also associated with the higher levels of discrimination and bullying and harassment among staff. And there are places that are doing great things. Of course, it's about having the staff numbers that we need in our organizations with the right skills to deliver the care, rather than exposing people to chronic excessive workload. It's also about having the courage to, as for example, East London Foundation Trust, a large community mental health trust in a challenged area of London, asking its staff regularly what they would reduce or get rid of in their work in consultation with patients and service users, they do this. And they have been reduced, and they get staff to vote on the nominations, and then they're the local teams are enabled to make the changes, reducing bureaucracy, reducing unnecessary travel to trust headquarters, reducing these requests for managers to approve training. They've eliminated 85% of clinical audit activities, yet they're rated as a good stroke outstanding trust by the Care Quality Commission. It's about developing multidisciplinary team working, where we empower local teams to make decisions about how to deal with workload. It's about using new technologies in the way we've seen during the pandemic. And I think most fundamentally, it's about changing the way that we conceptualize how we provide support and care for people in communities, where we move away from paternalistic systems that offer care and support to, as it were, a supplicant population, and that we involve patients, service users, communities in the genuine co-design and co-ownership of health and care services and housing services and public services. Because the existing models don't work, we're getting overwhelmed. And yet we see great examples of that community co-ownership and co-design, where this is working effectively in the Wigan deal, in Wakefield and Harrogate, place-based systems in the Bromley by Bow partnership in London, and further afield in places like the Nuka system in South Central Alaska, and in the Montefiore system in New York, for example. And all of this, I think, requires that we also have the courage to escape from the chronic excessive workload trap by taking time to be still and to reflect. That we know that from all of the research evidence that we've gathered, that teams are much more effective when they take time out to reflect, to review, to learn. Teams that do pre-briefs before a working day and debriefs at the end of the day. Community mental health teams that meet fortnightly to review what they're doing, how they're going about it, what they need to change. The evidence we have is that teams that do this are much more innovative, effective, and productive. In fact, the research evidence from the data from all of the published studies, one meta-analysis combined data from 49 separate published studies, and showed that teams that take time out on a regular basis to stop, to learn, to reflect, are between 35 and 40% more productive. This pathology of spinning the hamster wheel ever faster in our organizations is a barrier to productivity and effectiveness and innovation, and to engaging more authentically with those we work with. So to summarize, I'm not going to go through all of this, but these are the key points, the key issues that I've identified. And I'm sure that you will have copies of the slides, Catherine, after the event. But I want to finish by saying that in order to be a compassionate leader who has the courage to lead in a reflective way, to be still, to be peaceful, to be quiet, we have to have the courage, as Christy said at the beginning, to be self-compassionate. We have to pay attention to ourselves. You said that leadership self-awareness is our most powerful attribute. It's about having the courage to be self-aware in the moment as leaders, to relax into being self-aware, not to make it some gymnastic exercise, to then be open to understanding the challenges we face, the feelings of being overwhelmed or of inadequacy or shame or anger, and accepting those feelings. And then by accepting them, we can, in a caring, nurturing, compassionate way, engage with them. There's a beautiful book by Tara Brach called Radical Compassion. It's one of many. Kirsty Neff has written really great books about self-compassion as well, but describes the role of self-compassionate in our development as humans and as leaders. And it's about caring for ourselves. And because each of us is as worthy of love as every other human being on the planet. And when we connect with ourselves in an accepting, deep way, enabling us to work with these difficulties, then we connect deeply with our core values, like compassion and wisdom and courage. And we're also more likely to be motivated to help ourselves so we can be the best we can be, the best leaders we can be, as happy as we can be. And when we connect deeply and courageously and authentically with ourselves in this way, in a nurturing, caring, loving way, then it enables us to connect more immediately and deeply and authentically with all of those that we provide care for, and all of those we lead, and indeed all of those we interact with. So this all begins with having the courage as leaders, as humans, to be self-compassionate. So thank you.
Thank you so much, Michael. If we were all in the room together, we'd be hearing a large round of applause, I'm very sure. That was absolutely brilliant. Lots of food for thought there, and some really great links to evidence. And there was lots of comments in the chat about how having that evidence to back up a certain approach is really helpful, to sort of, because as you said, this is the only way that works, and we can't not do it for those reasons. So we're going to be going into breakout rooms now. We've got about half an hour for that, maybe just under half an hour. So as usual, we're going to put you into random groups of roughly 6 people. You may or may not have a facilitator, one of our team in the group with you. Don't worry if you haven't. It will be a bit of self-organisation needed there. As Christy said before, if you could keep your cameras on, because as much as you participate, the more you'll learn. And having the camera on helps other people know that you're listening to them. So that key quality of paying people attention. We don't know if you're paying people paying attention if we can't see you. So obviously you might have specific reasons why you can't keep it on, but in general, we like to encourage you to connect with each other. So introduce yourselves. You may want to reiterate confidentiality and make sure that if you're doing a lot of talking, you're noticing that and letting everybody else contribute. So these are the questions we'd like you to look at. And the questions are on the next slide, so do feel free to take a photo of them. How can I better model compassionate leadership for personalised care? So that's you yourselves. And what do I need to do to create space for reflection and learning for me, my team and my organisation? They're key questions. Okay, so we're going to send you off into groups. These questions will also be put in the chat, and we'll be asking then for some feedback and any questions or reflections you have for Michael. Just time for a few minutes of those before we close the session later on. So have a really great conversation, and we'll see you back here in about 25 minutes.
So I hope you had some good conversation there. We were actually just in a conversation ourselves in our room, and we were talking about modelling self-compassion. So some of us are going running, cycling, a bit of yoga this afternoon. I think Michael's doing some cycling, Catherine's doing some running, I'm doing some yoga. So yeah, we're walking. Is it walking the talk? Is that right? Anyway, whatever it is. So welcome back. It would be really, really good to hear a bit from you about what you talked about and what you want to share. So I can see there in the chat box someone saying that was a brilliant conversation and you learned loads thanks to your roommates. That's nice, Helena. So we've got about another 12 or 13 minutes until close. So should we get some conversation going in the chat? What would you like to share about the conversations that you've just had? And if anybody does want to come on mic, please do. It would be absolutely lovely to hear from you. And Alison, who else was doing the chat for us today? Maggie, lovely Maggie. So if you could just keep an eye on what goes on in the chat, and let's see if there's anything particularly that comes up for Michael, we'll make sure that we redirect it his way. So what did you get from the conversations? I can see some of you typing away. So we've got Paul there saying that the word of the day is allyship, which is, yeah, wonderful. Thank you, Paul. What have we got coming through in the chat?
There was a lovely comment from Helena about, you know, learning loads as well. She thanked her teammates, but she learned loads. I really like that. Oh yeah, and Jacqueline talks about putting herself in that vulnerable position in order to be a compassionate leader. Really important point, and we talked about that in our group as well.
Mm.
And I think the other thing that's there is it's sometimes really difficult to acknowledge that you need help. And we had a conversation in our room, and I think people were quite shocked at how difficult it is for some people who are not being helped. But we have to find strength to be able to ask for that, for what we deserve.
What else have we got coming through there?
There's a point about, got some, so Holly mentions a really good point about the quality of supervision and training and reflection. And we talked in our group a bit about that, and actually role modeling that reflection, but maybe giving people permission to kind of, sometimes we need to be given permission. It's interesting, isn't it? We learn this helplessness, but actually somebody role modeling it enables us to do it.
Absolutely.
And another one, I think this is really powerful, that we need to be able to feel that we can show how we feel, that we can show our emotion, we can actually operate as humans in a human world. And I think that very often we leave ourselves in a car park when we come to work, in lots, as managers, as people, and put up with things we would not be happy to deal with in our home lives.
Great. Thank you so much. And one of the reflections I had from this is sometimes it's really hard to give ourselves permission, isn't it, to reflect and to learn and to adapt. But maybe if we reframed it as, well, if we do that, what will the impact be on the people around me? So that we are seeing it through a lens of being supportive and there for others rather than ourselves. Sometimes just reframing it can really help us to be a bit kinder to ourselves. Thank you so much. That's wonderful. Molly, I think we've got a couple of slides now to share, if that's okay. We're just going to ask some very specific questions. Was there anything that came through for Michael in the chat? Or Michael, is there anything you want to say at this stage? You're on mute, Michael.
I think the comments about vulnerability and reflection and stillness are really really profound. That we know that leadership is most effective when leaders show humility, the humility to say, I don't know, which is a deeper truth for all of us. The humility to ask for feedback, the humility to ask for help, the humility to ask questions, to say, I don't understand. Actually, what those behaviors do is they give the people we lead confidence in our authenticity and in our competence, actually, as leaders. That's what the research evidence tells us. And so I think this principle of being reflective, being self-compassionate, these principles of being reflective, being self-compassionate, and doing the opposite of what somebody said about being hard on ourselves is key. Our aim, all of us, is to be happy, is to have happy lives and to enable others to have happy lives. And the route to that is through stillness and reflection and honesty and being loving towards ourselves and to other people.
Thank you so much, Michael. Thank you. Rosie, could you just pop the last few slides up, or Molly? Pop the last few slides up for us, thanks. Just a little bit more time to reflect now. So what we're really curious about on your behalf is one thing that you've learned or you're taking away from today. So again, if you can pop something in the chat box there, and if you do want to come onto mic and speak, then you would be absolutely welcome to. So one thing that you've learned or you're taking away from today. So I can see that, Sean, you said I need to work less and be still and reflect more. There's something very powerful in stillness and silence, isn't there? And I think they're things that we often overlook in our daily lives. Maggie, Alison, what have we got coming through? I can see it's coming through at pace.
Yes, and I'd just like to pick up the word kindness came through, and I just love that about kindness to myself. Thank you, Amanda, for that point. I think it's a really powerful one.
And I think there's lots of comments about actually making time, carving time out to create some of that stillness and that reflection time. So provide a structure to help to make that happen.
Yeah. It's about being firm with ourselves sometimes, isn't it? And recognizing that if we don't carve this time out for ourselves, then no one else is going to do it for us. Yeah.
The other thing I picked up a few times is around modeling, mirroring, reflecting, so that if we are kind to others, we will get that kindness back. And it's that thing around reciprocity between us as people who work together and do things with other people.
Great.
And what the research evidence suggests, Alison, is that when, you know, for example, people are asked to go out and do acts of kindness in their organizations or their teams, that has the effect of rippling out. So people not only feel better by being kind, but what the research shows is that those they were kind to go on to do helping acts for others, not simply reciprocate, but to be helpful to others also.
Great.
And so the emotional ripples spread out, which is really encouraging.
Thank you, Michael. Okay, let's move on to the next question for you to have a think about then. So what's the one thing that you will do next? What's the one thing you'll do next? If you could pop your answers into the chat box again, let's see what comes up. We know how our brains work. If we make commitments and we type them, or we write them, or we say them, we're much more likely to make them happen. I can see Fee saying she's going to take a lunch break today. Well, I hope the sun's shining for you, Fee. It's beautiful here in North London. What else have we got coming through, Maggie and Alison?
Lots of things about taking time, diary time out, some self-care stuff coming through.
Great, yeah. So if you've made a commitment to booking time in your diary, my question to you is, when are you going to sit down and look at your diary and block that time out? And when you do it, enjoy doing it and look forward to whatever you've blocked time out for. Okay, so let's, I think there may have been one more thing to consider, Molly, but we might be running quite close to the end now. There's a poll coming up here. So if you could take a look at this poll and tell us, on a scale of 1 to 10, how committed are you to modelling and growing compassionate and inclusive leadership? How committed are you to doing it? Let's see what comes up. So the numbers are moving, but we've got over 70% of you are saying 10 out of 10, you're committed, which is absolutely wonderful. And if you are lower than that, then perhaps there's a reason for that. So ask yourself what it is that's making you feel that at the moment you can't be 10 out of 10 committed. What are the barriers? What's getting in your way? What do you need to overcome? Wonderful. Okay, so Catherine, I think I'm going to hand over to you to see us to the end now.
Yeah, thanks very much. And I think there were a few people that wanted to speak, but in the end we just ran out of time. So I'm ever so sorry if you wanted to say something, but do feel free to put comments in the chat. Everyone can read and see those. A big thank you once again to Michael for his really inspiring input this morning, and to all of you actually for your really genuine engagement with this topic. Somebody saying I need to do this and it needs to start with me, and that is something I'm taking from this as well. And thank you for all your inspirational and really reflective comments. So we've got another masterclass coming up in May. The date of that is yet to be confirmed, so look out for our newsletter, and do feel free, obviously, if you've got other colleagues who you think might benefit from this masterclass series, do get them to register with us, and then they can have access to the materials as well. And it's just kind of beholden to me now to ask you to fill in our evaluation form, because unless you tell us what you got out of this officially, we need to make sure that we're funded to carry on doing this and carry on supporting you in this way. So please do fill in the evaluation form for us. But a big thank you from all the team, and have a really, really great day. See you soon. Bye everybody. Hit the music.